As the Delta variant continues to spread, questions tonight about whether a third shot, a booster shot, would perhaps better protect Americans.
And there are some doctors who say the third shot should target a specific group of people. Here to explain is Denver 7's Addie Guajardo.
The Delta variant is spreading, and it could pose a greater threat for people with weak immune systems, even if they're vaccinated.
A higher risk of breakthrough infection.
People battling cancer, have chronic conditions that require treatment, or have had a transplant are at a greater risk of getting severely sick if they get the virus.
Being hospitalized, and they have a risk of death.
Dr. Thomas Campbell with UC Health oversaw 2 major clinical trials for COVID-19 vaccines. He says while the vaccines available are up to 94% effective, people with compromised immune systems are less responsive to the shot.
Drops more to the 40 to 50% range. Their immune systems are suppressed, so they don't make the high level of antibodies that are needed to protect against COVID.
He says about half of the time, even after both shots, antibody levels can't be detected. To help protect those people from the deadly virus,
the evidence is there that immunosuppressed individuals need a booster, and they need it now.
A third shot to increase their antibodies, but more evidence is needed.
We don't know yet whether that actually will protect them from getting seriously ill with COVID.
The CDC is considering a third shot for people with compromised immune systems, but no decision has been made.
Well, I think it should be rolled out today, but we're not there.
On Wednesday, the World Health Organization called for a halt in the booster shot until the end of September, so the current supply can go to those who need their first or second dose. But Dr. Campbell questions that move.
I don't think that giving that select subgroup of individuals a third dose is going to have a big impact on our efforts to expand vaccine access around the world.
He says the immunocompromised make up less than 2% of the population in the U.S. and can spread the virus at a greater risk if they're not protected.
They will shed virus in their upper respiratory tract at higher levels and for longer periods of time than people who are not immunosuppressed.
He strongly advises people with weak immune systems to wear masks, socially distance, and wash their hands. Addie Guajardo, Denver 7.
Let's take a closer look at the numbers here. Pfizer says its booster shot of the current vaccine increases antibody levels 5 to 10 times over its 2-dose shot. They also said that over time, the vaccine's efficacy can decrease. Data shows after 6 months, the vaccine effectiveness drops from 96% to 84%. And the FDA, by the way, could grant full approval to Pfizer's vaccine by early September.